Great. And then we're going to go live and then we'll start the program. Okay, welcome everyone. Thank you so much for joining us this evening. We're in for quite a treat here this evening. We have the amazing Senator Rivera with us and Michael Kinnucan from the Fiscal Policy Institute. I'm going to read some biographies for both of our esteemed panelists. Then I will go over sort of the way tonight is going to go, and then we'll get right into it. So I know Senator Rivera is probably not a stranger to most of you here this evening, but Senator Rivera was elected to represent the 33rd Senate District in the Bronx in 2010. Only in 8 years, he then was appointed to become the chair of the Senate Health Committee, and we're so thankful for that. He became the first person of color to ever lead the Health Senate Committee, and he currently leads it today. As most of you know, he is the main sponsor of the New York Health Act, our bill that we champion each and every day that would, of course, establish a first in the nation single-payer healthcare system in New York State. We're also joined by Michael Kinnucan, who is the Director of Health Policy at the Fiscal Policy Institute. Michael has worked with labor unions and home care advocates across the country on Medicaid policy, long-term care, workforce, and employer-sponsored insurance issues. We're thrilled to have you both here with us tonight. Thank you so much. This is going to be a wonderful conversation. We hope that you learn a lot, and we hope that you become more engaged as the evening goes on and more engaged in our movement. So as I mentioned, we're going to have a very intimate discussion tonight with both of these panelists. I will be asking the questions. At the end, if there is some time, we will take some audience questions. We are on a very tight timeline this evening. So if we do not have time for audience questions, I will put a form in the chat where you will be able to submit your questions to us, and we will get you the answers to any questions you may have. So with that, let's go ahead and dive in. My first question is for, you know what? Hold on a second. Back up, rewind the tape. I didn't introduce myself. I'm so sorry. For those of you who don't know me, my name is Melanie Dorigo. I'm the executive director for the Campaign for New York Health. We are a statewide coalition pushing to pass the New York Health Act. Our coalition is comprised of hundreds of organizations throughout the state, including labor unions, C3s, C4s, grassroots groups, as well as individuals. We are a relentless force that keeps coming, and we are pushing with everything we have to make single-payer healthcare in the state of New York a reality. So now, with that, let's go to my first question, the esteemed Senator Rivera. Senator, as the Health Chair Committee Chair, you're responsible for shaping healthcare policy, for creating better access to healthcare, advocating for healthcare reform, and of course, leading the Health Committee, right, in the hearings, as well as the committee meetings. So your committee is responsible for all legislative matters that concern the health of New Yorkers. So I think it's fair to say that you have a front row seat to all that is working and all that isn't working for New Yorkers when it comes to healthcare. So can you give us a broad overview on what your thoughts are in terms of what you believe the state of healthcare is right now in New York?
Well, first of all, thank you for the invitation this evening. And to put it in a word, precarious is the way that I would put it. So let's just step back for a second to kind of get a sense of where we are in the state. The bigger piece of it is that certainly while I've been here, and I've been here 15 years, as you mentioned, I've been the chair of the health committee for a good chunk of that. But during that entire time, I think that there's been a lack of long-term vision for our healthcare system, and there's consistently been just like particularly as it relates to our Medicaid system, which is obviously one of the largest in the country. There's constantly been just patches that have been brought to it, and there has been a lack of vision at the executive level, which has meant that we haven't dealt with some crises that are many years in the making. So that's number one, and that's kind of the one of the biggest pieces. The bigger piece is the things that the tax that we're gonna get from the feds, but we'll get to that. As it relates to the city, I mean, I'm sorry, to the state, the fact is that we have very high Medicaid spending is correct, but that is in direct reflection to the population that we serve. When you have a system that is serves 1 out of 3 New Yorkers, uh, and we have a population that's only growing older, and it's going to have some they're going to have some issues in long-term care. All of those things are just making our you know our future even more precarious. And you can't forget that New York also has other publicly subsidized programs like Child Health Plus. Um, and all of these things means that we have made certain commitments to New Yorkers. Uh, but at the same time that we've made those commitments, as I stated earlier, sometimes there's been a lack of vision of how do we make sure that this system can be maintained and stabilized in the long term. And then we get the feds. And what we're gonna and certainly Michael will break down what is coming from the feds, but it's gonna be really, really, really nasty because it's going to make the things that are already hard in the state even harder. And the populations that we're talking about, certainly populations that are already at risk, are going to be even more at risk because while we care about these populations and we're having challenges in figuring out how to make sure that we can serve them, the feds have demonstrated they don't care about these populations. So I'm concerned. That's where we are.
Thank you, Senator. And we'll certainly dig in a bit more in just a little while. Michael, my second question is for you. You're the Director of Health Policy at the Fiscal Policy Institute. For those who are tuning in who may not know, FPI is an independent, nonpartisan think tank working to advance equitable fiscal policy. So, Michael, in your role, you're able to analyze health policy to determine its effects on the population and the economy. And your team has done quite an incredible analysis on the House reconciliation bill with regard to health policy. Can you tell us what healthcare changes were made in this reconciliation bill?
Yeah, absolutely. I want to echo the senator in saying it's a really nasty bill, really concerning. And I think it's important to just think about the stakes of federal funding for healthcare in New York State. We have almost 9 million New Yorkers on some forms of healthcare that are publicly funded and that would be impacted by this bill. That includes Medicaid, it includes the New York Essential Plan and the state exchange, New York State of Health, Child Health Plus. Across all those programs, we're talking about a system that supports something like 40% of New Yorkers. And it's not just a source of health insurance. It also is the main payer for long-term care in New York State. Home care and nursing home care are not covered by Medicare. They're covered by Medicaid, and they'll be impacted. It keeps local hospitals open. It helps support school-based health. It's a really, really crucial program, and it's funded with $130 billion of federal money every year, and most of that money is federal. So when we talk about federal cuts, those are the stakes. And so big picture, what this bill would do is reduce federal support for healthcare in a way that would impact New York $13.5 billion a year, right? So the state budget is about $250 billion a year. 13.5 billion is a really significant chunk of that. And the state estimates that 1.5 million New Yorkers could lose coverage. So that would reverse all of the gains we've made since the Affordable Care Act. We brought uninsurance down from over 10% to 4.9%. We would overnight lose all that progress and go back to a place where 11 or 12% of New Yorkers are uninsured. So it's really, really disturbing. And I'm just going to walk through really quickly some of the worst features of the bill and what's most at threat. A lot of the conversations we've had in public around this bill have focused on Medicaid cuts. Those Medicaid cuts are real and punishing. One one form of cut is a really significant imposition of red tape and bureaucracy to essentially try to kick people off of Medicaid and make it harder to stay on Medicaid. That includes work requirements and work certification requirements and twice annual eligibility renewals. We know from experience in other states that, number one, most Medicaid recipients who would be targeted by these policies already work, or they're the primary caregiver for a young child, or they're otherwise exempt. But despite that, I think anyone who's interacted with a government bureaucracy knows things fall through the cracks. And in this case, for a system this large, that means hundreds of thousands of people could fall through the cracks and lose health care. In terms of Medicaid cuts, the bill would punish states for covering undocumented immigrants with state-only funds. Now, I want to emphasize the federal government already does not provide any Medicaid funding for covering undocumented immigrants. We in New York and 14 other states, we do provide some state-only Medicaid for some categories of undocumented immigrants. The largest group is children. And the federal government under this bill, if it passes, will cut our funding for Medicaid by $1 billion a year to punish us for doing that and try to force us to stop providing health care to immigrant children. The bill would also would roll back an insurance tax that New York is using to fund its Medicaid program called the MCO tax. That cut could be as much as $1.6 billion a year. And that could start as soon as this fiscal year. It could start as soon as January. So the budget we just passed will be thrown into disarray. Another important source of cuts is the Essential Plan, which is covers 1.6 million New Yorkers. Most of the people who use New York State of Health to get coverage, they're actually on the Essential Plan. The reconciliation bill would make hundreds of thousands of immigrants who are enrolled in the Essential Plan, who are lawfully present immigrants, including the largest group is actually green card holders who aren't eligible for Medicaid because of their immigration status, would be kicked off the plan. So 750,000 of the 1.6 million New Yorkers who rely on the Essential Plan would be kicked off. That entails a $7.5 billion annual loss of federal funding. And because our courts have decided rightly that immigrants who are lawfully present, green card holders, and et cetera, have a constitutional right to health care, many of those folks who become uninsured through the Essential Plan would actually be moved back onto state-only Medicaid. So that would be an additional almost $3 billion annual cost to the state. And then for folks who get insurance through the individual market, they will see a really, really dramatic increase in their healthcare costs because all the immigrants getting kicked off of those programs will actually, will actually make premiums go up because it'll be a smaller, older, less healthy group of people who are insured. So insurance premiums will go up, but this bill dramatically reduces the amount of premium tax credits that people use to buy insurance on the exchange. So it's going to impact across those 9 million people. There aren't, every group will be really significantly impacted.
Thank you, Michael. This bill just sounds absolutely devastating, and you just gave us a lot of information, so I want to dig into it a little bit.
Sure.
For those who may not be familiar, can you talk a little bit about what the Essential Plan is, how it differs from the individual marketplace, and then just again kind of go over who are the people, who are the New Yorkers who are on the Essential Plan, and what these cuts specifically would mean for those people?
Yeah, great question. The Essential Plan is one of the best things I think that New York State does in healthcare, but it's sort of little understood. What the essential plan does is for people earning less than 250% of the federal poverty line, who in a lot of states would go on the exchange, they would use premium tax credits to buy health insurance, and the health insurance often wouldn't be that good. And so New York covers those people in a different way. What we do is we take all the money that the federal government would give us for premium tax credits for that population, we bundle it up, and we use it to provide publicly sponsored insurance that is like way, way better than the insurance that folks in other states would buy on the exchange. So this is uh, free or very low cost insurance, and it has very low deductibles and copays, and it's all funded through premium tax credits that we would otherwise use to buy not that great exchange insurance. So it's a really important program. It covers 1.6 million New Yorkers. You sign up for it through New York State of Health. So if you know anyone, like a kid or a neighbor or whatever who says, "Oh, I get my insurance through New York State of Health," they may well be actually on the essential plan because it's a big plan. And it covers both U.S. citizens and lawfully present immigrants, but it's especially important for immigrants because immigrant lawfully present immigrants are not eligible for traditional Medicaid, right? So if you're a green card holder for your first 5 years in that status, you're not able to get on Medicaid. And so instead, you can get on the essential plan and get equivalent coverage, which is really, really great, really important. There are about 500,000 folks who are in this situation. They're green card holders, they're not eligible for Medicaid. And what the reconciliation bill would do is it would say, if you're a lawfully present immigrant, if you're a green card holder in the first 5 years, or you're an asylum seeker or a refugee, or you're in temporary protective status, or you're on a student visa because you've come here to study, you will not be able to get on the exchange or on the essential plan and get insurance. You will be kicked off, and the federal government will not pay for that. And I want to emphasize, because there's been a lot of talk about undocumented immigrants being on Medicaid from the Republican side. We're talking about, I personally think everyone has the right to health care, regardless of immigration status. But we are talking about lawfully present immigrants. 750,000 of them will be kicked off the essential plan. Some of those people will be able to get on state Medicaid, and the state will pick up and cover them, which is a hit to the state budget, right? Others of those people, about 250,000 people, will just lose their insurance and become uninsured. And that impacts not only those individuals who can't get health insurance, health care that might be life-saving for them, but it will also impact the communities they live in. Local hospitals will close, kids won't get vaccinations, everyone will be less healthy. And so it's a really frightening, it's one of the most impactful parts of the bill. That alone has a $10 billion a year impact on New York State's budget.
Thank you. And I just want to mention too, I think sometimes when we say things like 250% of the federal poverty line, right? Like, what does that mean? We're talking about people that, correct me if I'm wrong, but an individual making that is like $37,000 or less, right? We're not talking about people who could go ahead and afford healthcare somewhere else. I mean, these are folks that are, I mean, how the heck can you live? I mean, if you're living in New York City, rent alone, right? I mean, these costs are unfathomable. Okay, thank you, Michael. And Senator, I promise I'm going to get you in here soon. And of course, if there's anything you want to add on to what Michael's saying, just, I want you to feel free to jump in.
Just a quick thing that I would say is that because I know you're gonna ask me about you're going to ask me about this later, but I'll just say it right now. The cruelty is the point. The cruelty is the point. All of what we're talking about is something that's going to make it far worse for the most vulnerable Americans to live and to be able to maintain themselves, to keep themselves healthier, just to maintain their lives. And that's the point. This is what Project 2025 was all about. They are implementing basically almost lock, stock, and barrel. Everything is in there. And something quickly I would say, I fear that as a state we were not as prepared as we could have been, and again that goes to the lack of vision in the state. And I think that there were opportunities for us to be able to do things to prepare for what for the things that were coming. None of this is a surprise. They told us they were going to do this. They told us. We know how bad it is now that we're like got the calculations in front of us. We all knew this was going to happen. It's not new. Anyway,
Yeah.
just
Thank you. It's such an important point. And you're right. I was going to ask you about that. We might still talk about it a little bit later. But this next question is directed at Michael first. But again, Senator, feel free to chime in here as well. But what we're hearing a lot is that the GOP does not want the media, does not want the public tying them to cutting Medicaid. And Michael touched on this a little bit in the first question I asked him, right? So they don't want us to say, oh, well, this reconciliation bill is a direct cut to Medicaid, right? They're really trying hard to distance themselves from that. And instead of a direct cut, the reconciliation bill does propose what Michael was mentioning earlier, right? These work requirements, this red tape, the additional paperwork, et cetera, which we know is a Medicaid cut. So Michael, I wonder how you would respond to that. I mean, can you talk to us a little bit more about that, what these cuts really mean for New Yorkers and how devastating they will really truly be?
The work requirements specifically, you're saying?
Yeah, the way they're sort of trying to distance themselves from Medicaid right there, because because to some people who may not be paying attention, it sounds, oh well, why wouldn't we want people to work and get health care, right? For folks who aren't paying attention, they're sort of duped into thinking it sounds reasonable. But we do know, I mean, I'll give you a chance to respond. The majority of able-bodied folks are able to work, right, when they're already working. And so I wonder if you could just expand upon that and why it's kind of a silly and ridiculous provision of this bill, in my opinion.
Yeah, no, absolutely. So I mean the folks who are targeted by this work requirement, people in the ACA expansion population, who make between 100 and 138% of the poverty line, which is very low income to Melanie's point. That's like $20,000 a year, but they do have income. They are working, right? And the challenge is going to be that this bill creates a system where the state is forced to implement a system where you have to confirm and reaffirm that you're working every 6 months, right? You can imagine for low-income people who might have unstable jobs or be in seasonal work, it might be ambiguous and confusing, and you have to get it right every 6 months. And if you don't get it right, then you lose your health care, right? Then one day you go to the pharmacy to fulfill your insulin prescription or your heart medication prescription, and too bad your card bounces. So that's one thing I'd say. I think the other thing, sort of zooming out a little bit from work requirements, is that when you cut the state budget by $13.5 billion, there is no way to squeeze some specific group of people with that cut. Every constituency that relies on Medicaid, and even beyond that, people, folks who, localities that rely on school aid and so forth, will be harmed by this. And something I personally am really scared about, right, is that, as the senator said, we have an aging population. The largest and fastest growing slice of Medicaid spending is for home care for elderly and disabled New Yorkers. And if we're plunged into the kind of fiscal crisis that this bill will plunge us into, then it's going to be really, really challenging for the state to avoid hurting those exact people, elderly and disabled people, who Republicans claim that they don't want to hurt, right? But the fact is that it's
don't
one
believe them.
funding stream. Yeah.
They're lying. I mean, I know it's not a surprise to anybody
Yeah,
else.
so I work for a nonpartisan C3 think
I
tank.
don't. They're lying. They're
Yeah.
lying.
Their statements are at variance with the facts. That's all there
Most
is to
elegant
say.
way to
Yeah.
say they're lying. And by the way, also something that's important to understand as well is all of these cuts would also have an effect on providers. It will have like there's a downstream effect on all these providers. We just had rural nursing homes coming in here talking to us about what their concern was related specifically to the MCO tax that's going to be ending imminently. So there's all of these things will have an enormous impact, and consider the fact that anyone who doesn't have access to healthcare, doesn't have access to something like Medicaid, won't have there. It's not like they're not going to get sick. It's not like they're not going to have need of a healthcare system, but they're going to need it. They're going to access it where? That's right, ladies and gentlemen, in the emergency rooms. And that's going to be the place that's going to be very expensive. It's going to mean that many of them are going to die unnecessarily. It's going to cost more. It's going to have a tremendous impact on all these institutions. So yeah, it is that bad. And
Right.
the Republicans did it, and the Republicans are doing it. They're lying when they say that they didn't want to do this. They told us they were going to do it. Project 2025. You can go and read it. Anyway, nonpartisan. Go ahead.
No, Senator, I'm so glad you took us there because that was actually my next question, right? There's
Whether they were lying or not?
no,
Yes.
not well,
Lying.
not I mean, I think you really nailed it earlier when you said they told us exactly what they were doing. They actually had a whole big plan, right? And some folks chose to believe it, and some folks chose to bury their head in the sand. But here we are dealing with the very real effects of what this is going to do to our communities. But I did want to underscore that point that you just made, right? Because obviously we're out in the community all the time, and we're talking to people about healthcare. We're talking to people about the New York Health Act and other, healthcare bills. And with this reconciliation bill, we keep hearing, oh, well, I'm not on Medicaid. So yeah, that's my heart breaks for these people, but it's not going to affect me. And the reality is that that isn't really true. Because, this type of a cut is going to have reverberating effects throughout the healthcare system. And I would love to hear from both of you on this. I know, Senator, you just mentioned a couple, but it could also have deleterious effects on other parts of the budget, right? So it will touch us all as a state. So I wonder if you can talk to that a little bit. If you're not on the essential plan, if you're not on the individual exchange, and if you're maybe somehow able to escape this Medicaid cut, there are many other issues that will arise, right? Like you mentioned, the emergency room, right? If you can't get care, that means the emergency rooms it will
Will
take
be
longer to do
further
some.
will be further squeezed because it's not like in some places many emergency rooms are already overburdened, and this is just going to make it worse. And also just and as far as the squeeze in the budget is concerned, we're going to have to make tougher choices because we're going to have less resources to distribute, right? So when it comes to making choices, not just about the healthcare system, but let's talk about basic public health issues, basic public health matters that we're not going to have enough money to be able to fund. And so we're going to have like, we're doing, I mean, there's like so much that's going to be that the impact that we're going to have across the system is not just, I mean, the folks who are stupid wealthy are going to be fine. The minority of New Yorkers and New York minority of Americans who are wealthy and pay for their care out of their pocket are going to be fine. But the overwhelming majority of Americans, not just the folks on Medicaid, but because those folks who are upper middle class or upper working class that still use the same system that overlaps with poor and working class people, those systems are going to be overburdened. And the impact also that it has in the community as a whole, when you have a lot of people there will no longer be efforts to actually do preventive medicine. Instead, we will move to more emergency medicine. All this stuff it's just negative all around.
Right. Michael, did you want to add anything?
Yeah, just in addition to, I mean, just to be explicit, we're looking at a wave of hospital closures likely across rural and poor urban communities if this bill passes.
And sorry to
That's
interrupt, but can you explain why that is to our listeners and our viewers? I think this is a really important point.
Yeah, absolutely. So there This is a perfect storm for hospitals that provide care to low income and also rural communities, right? Overlapping. Two different things are going to happen. Number one, there are going to be a lot more uninsured people. And uninsured people, when they come to the hospital, they have a right, thank God, they have a right to care, right? If they come for an emergency room visit, they have to be stabilized. And so hospitals in communities with a dramatically increased number of uninsured people, they're going to have to take on the challenge of caring for more of those people with less money, right? And then also, hospitals all over the state rely on state funding to keep the doors open, even outside the Medicaid rates. And the reason for that is that we, as New Yorkers, we believe that we should have an emergency room close by, whether we're in the Rockaways or we're up in a rural community upstate. And we think we have a right to that. But the market healthcare system that works on insurance negotiations and prices doesn't necessarily, the invisible hand doesn't necessarily put hospitals where we desperately need them. And so every year the state spends a lot of money to keep hospitals in communities that need them. It's crucial. And again, in a world where we're seeing a $13.5 billion fiscal impact to the state over one or two budget cycles, we have way less money to do that. And this is where the choices will get brutally hard, right? Do we slash coverage for low income people? Do we deny home care to elderly and disabled people? Do we shut down hospitals and make it so people have to travel another 45 minutes for emergency care? Right? Like if we have less money, we're going to find ourselves in those situations.
We could also talk for a little bit about nursing homes. Nursing homes are mostly funded by what? By Medicaid. So any Medicaid fluctuation is going to impact them worse, and they're already strained all over the place, right? There's barely any nonprofit ones around the state, and there's for-profit ones that are good actors, but there's other ones that aren't necessarily good actors. But they're being squeezed all over the place. So further cuts to Medicaid will only impact nursing homes, which will then and let's not let's not let's not beat around the bush either. It's just this is not necessarily related directly to the reconciliation bill we're talking about, but another one that I'm immensely worried about is the phenomenally stupid and badly bungled transition for CDPAP, the Consumer Directed Personal Assistance Program, which serves a lot of New Yorkers. Well, it was complete. The transition was completely bungled by the administration, so much so the Kathy Hochul administration, but to be clear, and so much so that now the feds are looking into it, and we're talking a program that's upwards of around $9 billion, that serves the most vulnerable, and then you had a badly managed transition, and now it's under investigation by the feds, and we have feds that want to cut every single thing that they have that is before them that could actually help vulnerable people. So the likelihood that they might actually come for that program, that's another hit that we might get. And that one, by the way, that one is an unforced error. I will just take 2 seconds as far as an editorial. That is the fault of the governor of the state of New York and how badly she mangled this transition. And she brought the attention of the feds that wasn't there. The feds weren't paying attention to this program. We had to fix it here in the state. And instead of fixing it, she further messed it up. And now the feds are looking at it potentially to cut it.
Thank you, Senator. Oh, Michael, you're muted.
Right. Can I add one more point on the original question, which is if someone isn't on Medicaid, they're not on the exchange, like how would they be impacted? Mm-hmm. People don't always understand everything that's part of these programs, right? Like if your nephew buys insurance on New York State of Health and pays $200 a month for it, well, that's not the full price of the health plan, right? That's the product of a lot of federal money subsidizing. Likewise, if you know anyone in New York State, an elder, a parent, friends of a parent who rely on long-term care, those folks are almost certainly on Medicaid, right? And so I think there are a lot of people who have a conception of Medicaid as like oh, it's like a very, a relatively small program for very poor people, and I'm not poor and I won't be impacted, who don't realize that in terms of care for their loved ones, in terms of exchange coverage, in terms of local hospitals staying open, they will be really directly impacted. Yeah.
Because remember, all this, our healthcare system is an ecosystem. It's all connected to each other. So it's like all of this to think that things exist, set on like separate. It's dumb. It's all
Right.
connected.
And now we're dealing with a system that was already very fragile, a system that was already failing many, many New Yorkers. And now this cut is going to be a catastrophic hit. So with that, my next question goes to you, Senator. I think you've both done a stellar job of outlining the severe impact on, the health of seniors, children, people with low income, people with disabilities, and really just, talking us through how New Yorkers who may not be directly affected will be indirectly affected, whether it's other reduced services or higher taxes or higher healthcare costs, right? And so it sounds like we're really sailing into, quite the storm. But Senator Rivera, you have been an incredible healthcare champion, and you have a bill. You're the main sponsor of a bill that I believe can really protect our healthcare, but also it can expand our healthcare. And I'm so wondering if you can tell us and tell our listeners, not everyone is familiar with it. Can you talk to us about the New York Health Act? If you can give us an overview of your bill and then tell us why you think it can protect our healthcare from these cuts.
Well, the New York Health Act is a bill that would create a single payer system in the state of New York, which means a comprehensive system that provides universal health care for every New Yorker. And the first thing that I'll say before I go any further is that it is absolute fact that any system, there's a lot of different versions across the world of a system that guarantees healthcare for people. You can't go broke in another country for getting sick. You can go broke in all sorts of ways in other countries, but you can't go broke from getting sick. That is not the reality in the US, right? That's not the reality in New York. So we need to move to a system that actually guarantees healthcare as a human right. And weirdly enough, it's a system that will actually be cheaper for us overall because it doesn't have the profit motive at its core. And that's what the New York Health Act would do. It's a plan that would have no premiums, no deductibles, no copays, no restricted provider networks, no out-of-network chargers. And the way that we would achieve that is the bill would create a system in which the main driving force of the system is no longer the profit motive. And the goal here is to take the interests of the patient and put it in the middle, have a system that's actually managed by people who are going to be impacted by the system as well. It is one system that will impact every single one of you, every single one of us, as far as legislators, every single person who's a state who resides in the state or is employed in the state full time. So you have all of the folks, including the folks who are managing the system, would actually be impacted by it as well. So which is one of the big pieces here is that having a board of trustees that manages the program, because I wanted to lead with those two things first, that it is a cheaper program of it all because it takes away the profit motive. Right now, insurance companies, which are my favorite, they're my favorite. In a very nonpartisan way, right, Michael? They're my favorite. They are the ones that are not in the business of providing you care. They're in the business of denying you care to keep more of your money. So if we move to a system that does not have the profit motive in the core of it, and then we move to a system that is managed by a board of directors, by a board of trustees, that are also going to be using the same system. They're not managing a system that is going to be operating, but that's going to be impacting somebody else. It's the same one that's going to serve them and their families. It's part of the bill that you have to be a patient of the system to be a board, to be a trustee member. So those are some quick things on it. But ultimately at the core of it, we have an opportunity in the state of New York. And this is a complicated thing, both technically and politically. But I believe that we need to be bold, particularly at this moment. Because in a moment we're having so much taken away from the federal government, and people will say, like, well, we're having so much money being taken away by the federal government. How are you going to move to a system that actually has that actually like is where people get their care for free. Like, how is that even possible? And the first thing I will tell you is that many studies have told us, including folks that are far more conservative than I would be, that moving to a single payer system like the New York Health Act saves us a hell of a lot of money. We're talking about billions and billions of dollars that are currently wasted in administrative costs that would not be wasted anymore. And we can do that in the state of New York by focusing on this bill. And again, it is complicated, but I believe that at this moment we need to be bolder than we've ever been. And I know you're going to ask more follow-up questions, but I wanted to start with those two big points for me.
Yes, no, I appreciate that. And I love that you included that even from conservative studies, it does show that this single payer system in New York would save a minimum of $11 billion a year, right? So that is incredible right now as the federal government is trying to extract not only our services, but it cut actual money from us, right? This is a bill that, as the senator said, would no copays, no deductibles, no more cost sharing, but it would include medical, dental, vision, hearing, prescription drugs, long-term care. We would get so much more that the federal government would not be able to rip away from us, and that is thanks to Senator Rivera, who's been our longtime champion of this bill. So it's a real opportunity. I agree with you, Senator. We do have to be bold, and I'm going to kind of give a nod to Michael here too in a nonpartisan way. While this bill has been championed by a singular party, the Democratic Party, healthcare is an issue that touches all of us, right? I always tell people cancer does not care what your political ideology is. It really doesn't, right? We all need healthcare. This is something that is for the greater good. And I agree with you that I think this is the time to really push with all our might for a more humane and just society and a more economical one. But let me get to.
And if I may, Melanie, because
Yeah.
there's a comment on the chat that I definitely want to talk about.
Okay.
Barbara Hafner says civil servants are hesitant to support the New York Health Act, which is true. Some unions are very supportive. Some public sector unions are not. He said many have NISHIP, and if they move to another state, they will lose their health insurance if they are on NIHA. Well, that is not accurate. First of all, if they go to another state, what happens right now, it is exactly the same thing that will happen then. What happens now if you go to another state, you will have the bill is being paid by your by the fund that funds the healthcare fund that pays for healthcare, and it will negotiate with providers in those states, etc. Basically, that's still going to happen if it's built into your retirement. It is still going to happen. So that doesn't change anything. What happens is if you are a resident of the state of New York and you are a retiree, you would be eligible for the system, which actually provides a much higher floor than the one that you have now, including no copays, no deductibles, dental, vision, long-term care, all included in the program, because you would be eligible for the same one that I would be eligible for, that Michael would be eligible for, that Melanie would be eligible for. So it's actually something that you would spend, and everybody would be spending less, including the union workers. And in case of unions, they would be able to negotiate. They will no longer have to negotiate for healthcare because it would be included as something if they're just a resident of the state of New York, or you're a full-time employee of the state of New York, meaning you're employed by some company in the state of New York, even if you reside, say, in Jersey or in Pennsylvania, but you work full-time in the state of New York, you would be eligible to get NIHA, to get the New York Health Act. And it includes current, and as far as the benefits are concerned, we actually have language in there in black and white that says that you at the very least would get exactly the same benefits that you get now. But guess what? It's going to be more because there's no networks and there's long-term care, which currently is not included in your benefits. So that's just as an example. So there is resistance, but some of that resistance, in all honesty, is based on misinformation about what the bill does and how it does it. Oh, can this explanation be put in writing, as this is the major concern when we have brought presentations of NIHA to our members? Absolutely. Matter of fact, what I'm going to do is I'm going to ask Tony, who's on the bill, who's here somewhere, who's my committee director, to look for a document that we have a bunch of documents that have been prepared over the last couple of years that answer this question directly that have been written by Dick Gottfried, by the way. So there's a bunch of those, and we can actually send it right here I'm actually going to look for them as I'm sitting here quietly while Michael answers the next question. So I can put it right in there and you can get the document. So yes, I'm on
Well,
it, Barbara. And
actually,
Tony is on
Senator,
it as well.
the next question is for you, but Barbara, I'm also happy to connect with you. We can definitely cconnect and we can get you that information. Absolutely. I have Barbara's contact information. So I want to touch briefly on something that came up before in our earlier conversation about these cuts potentially affecting rural hospitals and safety net hospitals, which we know do service a lot of low income people. And there's something really special about your bill, Senator, in terms of stabilizing rural hospitals and safety net hospitals. And I wonder if you can explain that to us.
Absolutely. So the thing is that it is true that there are some bigger hospitals in the state of New York that are not every hospital in the state of New York is nonprofit by law, right? But not all of them act as nonprofit institutions. Some of them certainly act as if they were for profit, the big institutions that get a lot of private payers. But when you talk about safety net institutions, rural hospitals across the state, all of them that serve mostly a Medicaid population are basically losing money every time somebody walks in the door. So the bill would actually includes language that says that the rates to be set, because the language itself in the bill does not set rates. It gives the authority to set rates to the board that's going to run the program, because it's going to run the system, but that those rates have to correspond to the cost of care. That is language that would be built into law, which is something that doesn't exist anywhere else. What would happen is that if you have right now, Medicaid pays down here, which Medicaid rates are garbage. We agree on that. Medicare is somewhere around here, and private would be over here, private payers. Well, how about we move everybody to right about here? It's not going to be private payers, but it's not going to be Medicaid. Basically, every single institution would immediately have more revenue coming in because they would be serving patients that give them reimbursements higher than the ones that they get now, just by serving the community that they already been serving. And by doing that, institutions like the one I always talk about is St. Barnabas Hospital, because it's right in my backyard, and it's the one that it has always been it was always in my district. Now it abuts my district, like the southern the southern line of my district is right on St. Barnabas is like right here. So they still serve a whole lot of people in my district, and so it's an urban hospital that serves mostly Medicaid patients by a lot. Over 90% of the people that go there are Medicaid patients. They would immediately see their revenue go up because they would get more revenue from serving the same population that they've served, because the rates have to correspond to the cost of care. And the same would happen in rural institutions across the state and safety net institutions in other parts of the state that are not urban.
Thank you. And I think we actually had a question come up while you were answering that about provider rates. So it was perfect timing. I appreciate that. I think we've addressed through other questions, some of the additional questions I had. So it looks like we will have a little bit of time for.
Oh, wait a minute. Man, are you saying that there's like a Dick Gottfried ask a Dick? I mean, that sounds terrible, but ask a Gottfried. So there's a link
Yes.
there. That is
So
dope. So
we have one also that I'm going to put in the chat in shortly. But yes, Dick
I
is
think
doing
that's
that.
Dick's. I'm looking for Dick's, Melanie.
I don't know what you said, but it sounded dirty.
I said I'm looking for Godfrey's one page.
yes.
We have one as well. I'm going to put a form in shortly once we're finished with the program, but I appreciate all the humor here. So I want to ask, one more question to both of you, and then, if there are additional questions, we can do that. Otherwise, folks can fill out our form. But firstly, Michael, I wanted to give you an opportunity to jump in the chat here. I mean, I know that a very large coalition formed when we first started to hear about what these federal healthcare cuts might be, what they might look like. There were some massive protests. A lot of organization went into pushing back against, I think, some of the harsher measures. I mean, which sounds ridiculous as we really examine what actually did pass. But I wonder if you could just, briefly share with us what you learned from that, from all that organization, and what you think individuals can do in this moment.
Yeah, absolutely. Yeah, absolutely. As bad as this bill is, there are things that were being discussed back in February as potential cuts to Medicaid that would have been even more disastrous for more people in more places than what's in this bill. And they were beaten back step by step because, you know, I, we healthcare advocates statewide and nationwide just made it really clear to Republicans that if they imagine they represent a district that doesn't rely on Medicaid, then they are wrong about that. That every congressional district, every hospital, every community in the state needs health insurance and long-term care that Medicaid provides. And so we were successful in preventing, for instance, the block granting of the program, really dramatic cuts to the federal Medicaid matching rate for blue states. Like there were things we beat back. And I think that I think that in some ways, right, like we beat back the first round of like horrible ideas, but then what we wound up with was a bill with a lot of other horrible ideas, and now we still have an opportunity to fight those and to really make it clear to legislators that we're not going to stand for it. I think also, you know, it this bill may well pass, and so I just want to really echo and endorse what the kind of thinking that Senator Rivera and Melanie are doing here, which is to say a lot of Democratic state elected officials in New York State, if this bill passes, they'll say, well, the Republicans cut, so we got to cut. We don't have any choices, right? There's less money, so we're just going to slash benefits. We're going to throw people off healthcare. That kind of thinking, not only is it not true, we still have choices. We still have choices both to raise more money by taxing the rich, but also to run a better, more efficient, more comprehensive healthcare system that costs less money, which every other developed country can do, so we can too. So it's not true that we don't have choices. And also, we don't really have a choice to just cut, right? There isn't, unless we're talking about, ending protections for people who need emergency care when they show up to the hospital, one way or the other, we are gonna pay for healthcare here. The question is, do we do it in a way that drives people to bankruptcy and that causes people stress and fear in the most vulnerable moments of their lives, or are we going to do it in a sensible way? If we're trying to do it in a sensible way, then actually Medicaid is a much more efficient way to cover people, and public insurance more broadly is much more efficient. Not only in the once we pass the New York Health Act, but even right now, the average cost of Medicaid for an expansion enrollee in New York is only about $6,000 a year, whereas employer-sponsored health insurance costs $9,000 a year, right? Like right now, if we had the idea that we just need the private sector to pay for it, we'd all be paying more. So that's not a sensible policy direction. We need to really fight that thinking both in the passage of this bill and after it passes in the state legislature here in New York, if it does pass.
Yeah, and we can't be, and the thing is that this is not the moment to be passive. And I know that many of my colleagues think of it that way. Most of my colleagues think that what we should do is we should go into a bunker mentality and wait this out. I think that is like completely like not only not productive, but completely idiotic. I think this is the moment when we have to be out there. The reality is that the type of things that we're talking about impact everybody regardless of party. And I think that there are ways that we can actually talk about this in a way that connects with real people's lives, regardless of where they're born, regardless of where they're from, regardless of where they live, regardless of what party they belong to. And so I believe that if we express clearly this is something that we want to do, that we fundamentally change everybody's lives, would make a system that would actually serve you, unlike the one that you have right now. That's a message. I think that's a message that can stick. We just have to be bold enough and courageous enough to say it. And I think that's where y'all come in, certainly as it relates to the long term. In the immediate, as far as this bill, You gotta get to your, like, anybody who has a Republican member of Congress needs to be up their bunghole. You need to really call and email and you remind them that the things that this bill would do would impact people in those districts as well. That is an absolutely essential thing that y'all need to do as well. Melanie, you're muted.
Thank you. I was saying on that, you are a state legislator, right? So you don't have a vote in this process with this reconciliation bill, but the state legislature.
Nor do I want one. I'm
Right.
good.
But the state legislature can protect us, right, by passing the New York Health Act. So what is your message to listeners? I have some action items, but can you give some parting advice or parting actions? What do you want us to do to help you pass this bill?
Well, certainly join the Campaign for New York Health because there's something that they're always doing, something that Melanie's always figuring out where to get further action, get people further involved, and get people further educated. And then as it relates to my legislative friends, both in the Assembly and the Senate, if they're not sponsors of the bill, if your state legislator is not a sponsor of the bill, tell them that they need to become sponsors. And if they are sponsors of the bill, tell them that they need to become champions of the bill. It's not just about having your name on it. It is about making sure that leadership knows that it is a political necessity. So that's the type of thing that we need for all of you to do.
Thank you, Senator. And I'm just going to drop right now into the chat. I know many on this call are pretty well versed in the New York Health Act, but I know there are some of us who are not. We are doing 2 New York Health Act 101. So these are basic. If you've got friends, if you have family members, you have organizational leaders that you want to learn more about this bill, please invite them. We're doing one on the 9th and one on the 17th. We really want people educated to be able to understand what this bill is. We do have 3 minutes. I apologize tonight. We do have a hard stop at 7, but I do want to quickly address a question that just came in by Peter Arno. Wouldn't the Medicaid cuts that are in this bill adversely impact financing for the New York Health Act? I have an opinion there that I'm happy to share, but I do want to give our panelists, okay, so here's my take on this. Yes, it is true, Peter, that these Medicaid cuts will impact some of the funding mechanisms of this bill. It's also true that if we do not move to a system like the New York Health Act, that is the only bill, it is the only solution that will control costs and save money. We're in for a world of hurt one way or the other. We will see sicker populations. We will have neighbors that die because they do not have health care. And as Michael mentioned earlier, one way or another, we're paying for it. We're paying for this health care somewhere. It's not as if, you go to the hospital, you have no insurance and they take care of you. That's not just free, right? That comes back to all of us. So we are paying for this. So yes, it may impact the financing a bit. But that said, we need to figure out a new solution, and it can't be a shrug of the shoulders and say, well, people are just going to die like that, like Jody said this past week, right? That's not good enough. We are in an unprecedented time where our federal government is coming at us with such cruelty and coming for our most vulnerable. And it is well past time that New York State stands up and fights back, and we can do that with this bill.
And really quickly, we actually, Tony, thank you, Tony. We dropped a link to a document, common New York Health Act questions, which includes some of the issues around retirees. So that is the document that Tony Kurgaravat dropped into the chat there.
Great.
Oh, by the way, 6:59, the debate's about to start. Do not rank Cuomo. Do not rank Cuomo. Don't rank evil Andrew Cuomo. I'm partisan, bro. I'm partisan. Don't rank evil Andrew Cuomo. Don't.
Oh my goodness. Yes. Thank you for that, Senator. We appreciate it. Thank you so much to all of our listeners, all our viewers who tuned in tonight. As I said, we do have opportunities. If we were not able to answer your questions tonight, I will drop the document in in the chat again, and I think there's another, PNHP has one in there as well, so plenty of opportunities to ask us questions and get your answers. I'm also going to put my email in the chat. If you would like to set up an event, if you would like to set up some education, please reach out to me. We are more than willing, and we're very excited to do so. Senator Rivera, Michael Kinnucan, we are so grateful for your time this evening, for your knowledge, your expertise, and for championing a better world for all of us. So with that, good night, everyone. Thank you so much.